Okay, so we're coming to the end now then. So just to recap really, what the sort of thing that you can do to improve life after stroke for your residents. If when you're working with people, you encourage them as soon as you get that person, if you encourage them to engage in activity with you, create the conditions where activity is encouraged all the time, encourage people to maintain as much independence as they can, and I think that's more to do with providing opportunity. I know that people have good days and bad days, and there might be good times and bad times as well, and times when they're tired or not in the mood. So it's basically providing the opportunity every time that you're going to engage with that person, even if they've said no last time. You know, it's just providing the constant support. So some people can be supported physically or positioned better so that they can do things like Jo was showing you earlier when she was talking about seating. Sometimes people can be prompted or directed through a task rather than physically helped. You could demonstrate what the person needs to do to them so that they know what to do. You could change or encourage aspects of the task to be changed to accommodate a weakness or paralysis. An example we had was that sometimes people might use their teeth to pull something instead of the unaffected hand. You could use adaptive equipment. Sometimes equipment can bridge the gap between the person's abilities and the skills needed to do something. With stroke in particular, it's being aware that the people can be fatigued, so they're not always going to perform in the same way on every occasion. If you're encouraging and motivating and provide the opportunity for people as well, and provide time for the person to be able to do the activity or part of the activity. Supervising the activity, like we were just doing then, with prompting to stand and things like that. Always encouraging and building people's confidence. And if the person's got equipment or been taught techniques, just reinforcing those all the time. So, to conclude then, encourage meaningful activity with your residents whenever you can, and encourage them to maintain as much independence as possible with whatever activity you're doing, and create the conditions to enable the person.
The OTCH study was devised to assess the value of occupational therapy for survivors of stroke and TIA living in care homes. The study provided occupational therapy visits to residents of care homes across England and Wales. It soon became clear how important the role of care home staff was in maintaining and improving residents' quality of life. Their support was vital to the therapist in allowing them to support the resident to help them achieve their goals. We devised the DVD to provide a reminder to staff of the specific needs of residents with stroke. I would like to take this opportunity to thank everyone involved in this project. Care home residents and their relatives, staff from care homes, university, NHS, stroke research for primary care networks, and social care employees. I'd also like to thank the service users, collaborators and the advisory committees, and finally the funders, the NIHR HTA and West Midlands Strategic Health Authority.